They make a powerful impact on patients and play a critical role in delivering quality health care. We're helping to celebrate American Pharmacists Month, and joining us is Dr. Cynthia Feldman, CEO of Sweetgrass Pharmacy. Good to have you.
Hi, thanks for having me.
So there are differences between pharmacies. There's your CVS pharmacy or the Walgreens, your garden variety versus a compounding pharmacy. So what is the difference between these?
Sure. So a regular CVS or your big box stores do a great job dispensing medications that are manufactured. However, with a compounding pharmacy, we make medications specific to a patient. So not all one size fits every person. So whether it's something specific for your 4-pound dog or for your 90-year-old grandmother, we can make it so it's the right dosage, the right flavor, or the right route of administration.
How interesting. So you really are doing chemistry right there
all day
to
long.
Order.
All day long.
And
yes.
Where do you cultivate all of the ingredients, as they were, to make a particular compound?
So we purchase things called API, active pharmaceutical ingredients, from many wholesalers. So there are lots of opportunities, and so that's basically us buying the raw powder of the drug and then making it into the dosage form that fits you.
So when you see those signs with the mortar and pestle, that literally is what you're doing.
Literally is what we're doing. Now we have some upgrades, of course. Okay. So it's not all mortar and pestle. We're very, our pharmacy is very sophisticated and lots of upgraded equipment, but there is still mortar and pestle being used every day.
Oh, interesting. And there's a further distinction that we need to also address, and that is the difference between a sterile and a non-sterile compounding facility.
Oh, absolutely. So a difference between a sterile and a non-sterile is the types of dosage forms that are made. So non-sterile compounding pharmacies make things like capsules, gels, creams, ointments, things that are usually applied topically or ingested orally. A sterile compounding pharmacy makes things like injectables, something that you're going to inject into the bloodstream or subcutaneously or intramuscularly, or also eye drops. So specialized eye drops are something that Sweetgrass Pharmacy does a ton of, and kind of one of our specialties inside of the sterile realm.
And you are the only sterile compounding facility here locally?
Retail-wise, absolutely.
Retail-wise?
Yeah.
Otherwise, you'd have to go to Columbia or some
Charlotte,
other faraway
something
city.
like that. Yep.
Really interesting. Do you work with doctors, though? Those doctors that they initially write the prescription, but can you also not necessarily diagnose somebody, but can you suggest other things that maybe the doctor didn't?
Yes, absolutely. So the pharmacists that work with me all have doctorate degrees, and we are constantly being consulted by physicians. They call and say, hey, this is what I've got. How can you help? Because although the doctors are really great at diagnosing and knowing how to treat, they might not know what the options are of the best way to get the patient treated. So it's very important to have good open relationships with physicians and practitioners so that they feel comfortable calling us and saying, help me out here, or just sending us maybe a culture of a bug that a patient has and saying, what do you think is best for us to treat this with?
Gosh, you're right there, just scientists and chemists working for these patients. And I find that with some doctors, they're not familiar with some of the more holistic forms of healing and holistic types of vitamins and other types of medicinal type solutions. So you, I would imagine, have to know what those contain and how they may interact or not with pharmaceuticals.
Absolutely. So I really feel like it's very important for patients to have a relationship with their pharmacist just because of that reason. So without a really good relationship with your pharmacist, you may be taking an over-the-counter supplement or vitamin that might interact with your medications, and your prescriber, your physician, may never know, because oftentimes we don't talk about our over-the-counter meds when we're at doctor's appointments.
Yeah, that is true. Well, get to know your pharmacist, and here she is, Dr. Cynthia. She's ready to answer your questions. I want to thank you so much for joining us, and we celebrate our pharmacists this month, and also let's not forget the week of the 16th through the 22nd. That's also Pharmacist Week.
Yes, absolutely. The whole month of October, National Pharmacy Month, but the week celebrates just pharmacists.
All right, it's October for you. We're back after this.